Hello friends, today we will learn about common breastfeeding problems and their solutions. 4 common breastfeeding problems and their solutions. Here are some of the most common breastfeeding pitfalls you might face as a new mom, and their solutions. It is often believed that breastfeeding comes naturally to babies and mothers. But despite what you may believe, the practice can be difficult for many new mothers. Not only does this affect the baby, but it can also adversely affect the mother too. Here are some of the most common causes that make breastfeeding difficult for first-time moms despite proper lactation and what you can do about it. Engorged breasts. Breast engorgement is common among new mothers any time between the 2nd and the 5th day after delivery and childbirth. The most common cause of this is the inability to nurse and feed the baby frequently or to drain the excess milk produced in the breast effectively. As a natural process, after childbirth, a mother's breast prepares enough breast milk for the baby's nourishment and needs. However, there can be a possibility that even after adequately feeding the baby, the mother might be unable to drain the milk completely. This excess milk remaining in the breasts could lead to engorgement. When the breasts get engorged, they appear swollen, full, and hard. They can also be painful when touched. Engorgement is a serious issue and should never be neglected, as it would not only cause problems to the mother, but will make it difficult for the baby to get a proper feed despite the breasts being filled with milk. This is because a hard areola makes it difficult for the baby to latch on it correctly to continue with a smooth feeding session. What you can do. If you feel that your breasts are turning to be taut, hard, or full even after you have fed your baby to his satisfaction, try and express some milk from your breasts manually. You can use an electric or manual pump for this purpose. This is believed to be the easiest and most convenient way in treating engorgement. If you fear that excessive pumping can make your baby remain hungry during a subsequent feeding session or provide with less nourishment, then you can store your breast milk for your baby's consumption later. Rest assured that even while you help yourself deal with engorgement with continuous pumping, your body still produces enough milk to meet your child's needs and requirements. Feed your child often and oblige to demand feeding as well, no matter how short the interval span between 2 feeding sessions are. This will help you drain out the milk effectively and naturally. Try hot water fermentation. Alternatively, you can also use hot water compresses on your breasts that would help some letdown of milk and initiate the process of manual expression by your hands. Treat engorgement promptly, either at home or seek a doctor's advice. If neglected, this can lead to an infection or an abscess, whose treatment would either be a week-long dependency on antibiotics or surgery for extreme cases. Blocked or plugged ducts. Breast milk is produced by small milk-producing glands or tissues, called alveoli, present inside the breast. The milk produced by alveoli then collects under the areola. During a feeding session, the baby latches onto the areola and suckles to feed self and help you empty the breast. However, there can be times when a milk-producing duct or alveoli is blocked internally. This usually happens if the production of breast milk and the suction by your baby don't match each other's speed and frequency. Excess milk, if not drained effectively, can cause one of the ducts inside the breast to get blocked. This is because the duct keeps producing more milk without proper letdown. Sometimes even thickened milk can obstruct the flow from one of the alveoli, leading to a blocked duct. With a blocked duct, there would be a swelling or a lump formed in one of the breasts that could appear hard or painful when touched. If ignored, this situation can lead to engorgement too, or any other kind of infection. An infection with blocked ducts can either lead to mastitis, where a part of the breast becomes hot, swollen, and painful, or an abscess where the breast appears to be full with fluid when examined. What you can do. Nurse your baby often to get rid of the milk buildup in the breasts. If you feel a swelling or fluid buildup in any one of your breasts, feed your baby from that particular side more often. If you feel that a blocked milk duct can harm your baby, understand that it is the most natural way to treat the problem. Your baby will not be harmed by the swelling in any way. Massage your breast in such a way that you point the lump towards the nipple while massaging. This will help the duct to empty with proper suction and feeding techniques. Try different feeding positions to drain your milk effectively from a blocked duct. If you prefer to feed your baby lying down, try sitting upright and holding your baby right under your arm. Trying a different position may help you remove excess milk from your breast effectively. Flat nipples. For your baby to enjoy the benefits of breastfeeding, it is important that your nipples are protractile enough for your baby to latch on them and continue with a feeding session without much fuss. In some rare cases, however, the mother's nipple might remain inverted or retracted and hence make it difficult for the baby to establish a perfect latch and quench his hunger and thirst. If you are lactating enough, then the milk production inside the breast without proper letdown can also lead to engorgement or other related infections. So, it is imperative to treat flat nipples to promote proper breastfeeding. What you can do. To retract the flat nipples, use a disposable syringe. Take a 10 ml plastic disposable syringe and cut the nozzle part of it. Place the cut end on the nipple and pull the piston out and hold to that position for at least 1 minute. This will help the nipple to protrude out due to the pressure of the suction. This is usually known as inverted syringe technique. The protruded nipple can stay in that position for some time before it retracts to its previous position. When the nipple protrudes out a bit, put your baby on the breast and start to feed. This will help your baby latch better and empty your breasts, saving you from engorgement, blockage, or any other infection. In case the cut end of the syringe makes it painful for you to carry on with the process, use the piston on the cut end and place the smooth end of the syringe on your nipple to start the procedure. Try this procedure a couple of times during the day to deal with the problem. It is usually seen that with constant inverted syringe treatment and regular latching and suckling by your baby, the retraction issue can be resolved to a great extent. Alternatively, if you have flat nipples, try to massage them during your pregnancy, protruding them outwards. In some cases, this helps to deal with lactation issues due to flat nipples post-delivery. Cracked nipples. Sore or cracked nipples are common in new moms, especially during the first week of breastfeeding. This is usually a result of improper latching or incorrect positioning of the baby during a feeding session. Another probable cause of soreness at the nipples is due to the introduction of artificial nipples like teats or a pacifier during the early days after birth. These could result in nipple confusion and lead to improper suckling at the breasts, causing soreness or cracked nipples. Frequently taking the baby off the breast without breaking the latch would also lead to soreness. What you can do. Continue breastfeeding your baby despite the soreness or cracked nipples. However, position your baby in such a way that your baby has more of the areola in his mouth, which will reduce pain due to soreness and promote healing soon. Also read about the 5 hidden benefits of comfort suckling. Your breast milk can also help in healing cracked nipples and will treat the soreness. So, apply few drops of hind milk on the cracked region and allow it to dry. Ensure that your nipple area is completely dried after every feed. Treat the soreness promptly, as it can give rise to a fungal infection and lead to oral thrush in your baby's mouth. Avoid washing the nipples with soap after feeds, as this could promote dryness and lead to more soreness and pain. Avoid using over-the-counter ointments to treat cracked nipples or soreness, unless prescribed by your doctor. If you have some other tips, please do share with other readers in our comments section. To stay up to date with my latest videos and amazing health tips, make sure to subscribe to this YouTube channel by clicking the subscribe button, and do not forget to press the bell icon to never miss another update. Thanks for watching.